Hi, Vetfolio Voice listeners. Welcome back. In this episode, sponsored in part by DECRA, I'm joined by Dr. Elizabeth Colleran to discuss the use of Mirataz for managing weight loss in cats. So, anyone who's ever battled with weight loss or administration of oral medications in cats knows that these can at times feel like insurmountable hurdles. So, the availability of a medication designed to address both of these issues is a game changer. Let me tell you a little bit about my guest, and then we'll go ahead and get into our discussion. Dr. Elizabeth Colleran is an author, speaker, consultant, and feline specialist board certified by the American Board of Veterinary Practitioners. She's successfully created and managed 2 feline medicine practices. Dr. Colleran chairs the cat-friendly practice for the American Association of Feline Practitioners, or AAFP. She's served on the AAFP board for several years, including as president. She also serves on the American Veterinary Medical Association Welfare Committee and is a volunteer for many other projects. Dr. Colleran is a published author and frequent contributor to several peer-reviewed publications. She's been a media spokesperson on a number of feline topics for communications campaigns and has proudly mentored many aspiring feline practitioners. We're thrilled to have her with us today. Let's get going. So today I'm joined by Dr. Colleran. Dr. Colleran, thank you so much for joining me here to talk about mirtazapine.
It's a pleasure to be here. Thanks for asking me.
So we're here to discuss Mirataz, and that is one of the only FDA-approved transdermal medications in cats, which I think any of us who have tried to pill a cat who isn't feeling well and doesn't want to eat can definitely see the advantage in transdermal dosing. But can you talk about your experience using Mirataz?
It's actually been a game changer for myself and for my clients. I'm a big proponent of preserving the relationship between cats and their people while at the same time delivering effective therapy for a particular condition. And in this case, it does both, and it does it so well that we're all very happy to have Mirataz in our armamentarium.
Absolutely. Absolutely. So, anybody who has worked with me knows that I like the whole team involved, and I think you and I have that in common. So, how do you involve your technicians in recognizing feline weight loss and communicating about weight loss with clients? How do your technicians feel about using it?
First of all, they really like using it. We use it for a wide variety of reasons within the hospital. But one of the most important things for my team is that everybody knows that the weight of a cat is a clinical sign. There isn't a cat that ever enters the building and leaves it that doesn't get weighed while they're there. And if they're there for any period of time, they get weighed every day. It's just the most important clinical sign, and we make sure that we record it. And so everyone is aware of how important weight loss is in cats, and therefore the importance of making sure the cats are eating regardless of what we're treating them for.
Sure. And I know you mentioned that you feel like it's been a game changer. It's making things a lot easier on clients. Can you elaborate a little bit on how your clients have responded to it?
Well, my clients rarely ask me for medications for their cats. They rarely volunteer. But if they if they have a cat that for whatever reason has needed Mirataz in the past, and that condition has either recurred or something else has happened to affect their beloved cat's appetite, they'll actually call me and ask for it by name.
Oh, wow. So it's something that they're saying, we know what this stuff is and it works.
It works, and my cat's not hiding under the bed after I use it.
That makes sense. That makes sense. So mirtazapine, it's an antidepressant and it also decreases anxiety in people. Do you think that's why it's working in cats?
That's a really good question. But one of the things we do know is that it's approved for use for 2 weeks, but that doesn't mean it doesn't work in other settings. I have a clinic that administers irradiated iodine for cats with hyperthyroidism. And you can imagine how stressful it would be to be in a strange place among strangers for cats. And so when they don't eat on that first day, they get mirtazapine and they eat after that. And so I'm sure that stress and anxiety plays a great role in their being out of their home range and away from their people. And yet, mirtazapine will give them the appetite they need to tolerate it.
Sure. And you're talking about using it for hospitalized patients, which makes a lot of sense. What other kind of cases do you use Mirataz for?
Well, one of the most important things we know about cats is if they don't take in adequate calories for any period of time, no matter the reason, their liver will get sick. They will get sicker. As a hypercarnivore, they absolutely have to eat in order to recover from whatever it is. So we use it very generously for a wide variety of reasons, from any kind of chronic illness to just something that, a cat who has had a cat fight abscess and just isn't feeling quite good enough yet to eat. So it covers the expanse of things that will cause cats to stop eating that we see in the hospital.
And kind of the opposite of that, are there any cases where you would say it's contraindicated and you wouldn't recommend using it?
Well, sure. I mean, any cat that is vomiting, of course, we need to control GI symptoms first. So, we need to make sure that the cats are comfortable eating. Any of those things that would cause vomiting or acute nausea or something like that, we're going to control that at the same time, and then we're going to implement our Mirataz.
Sure. So making sure that we're pursuing good workups for our patients and discovering that underlying cause rather than just kind of like putting a band-aid on it.
Oh, no, there's no way. One of the most important parts of this is making sure that we understand why the cat's symptoms are what they are and what we're going to do about that underlying primary illness. Nothing symptomatic is a band-aid. This is just a way of accelerating healing by making sure the cats are taking in enough nutrients.
Absolutely. Absolutely. Well, I can definitely see it being a game changer and making a huge difference in the quality of life for our feline patients and, for their owners as well, preserving that human animal bond. Is there anything else you'd like to share with us about Mirataz?
Well, I think Mirataz truly is a game changer, and I just wish there were this vehicle of transdermal administration worked for a lot of other things, because it would certainly make my life much better.
I totally agree. Well, Dr. Colleran, thanks again. I really appreciate you joining me today.
It's been a pleasure. Thanks for asking me.
All right, everyone. Thank you so much for joining us for this episode. Thank you to DECRA for making this possible and to Dr. Colleran for sharing her time and her expertise. If you'd like to find more episodes like this, click on the Education tab on Vetfolio's webpage. As always, we'd love to hear your input on this session, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassi DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.